In this video, we briefly overview the procedure for applying standardized ventilator settings after enrolling a patient in the IMV domain of the practical platform. The standardized ventilator settings are employed to assess respiratory mechanics and lung function prior to randomization in order to be able to compare different patients in a standardized way. After enrolling the patient in the IMV domain and before randomization, standardized ventilator settings should be applied. For the standardized ventilator settings, the patient can be placed in one of the following modes: pressure control, pressure-regulated volume control, or pressure support. The ventilator should be adjusted to obtain a tidal volume of 6 mL per kilogram predicted body weight. The PEEP set to 10 centimeters of water or lower if needed to maintain a plateau pressure less than or equal to 30 centimeters of water. A respiratory rate to maintain a pH greater than 7.15, and FiO2 to maintain a saturation of 90 to 95%. After 30 minutes on the standardized ventilator settings, respiratory mechanics and lung function are assessed by measuring airway opening pressure and respiratory system elastance, and by obtaining an arterial blood gas. An important note: when the patient is in an assisted ventilation mode, the airway opening pressure cannot be done. Respiratory system elastance is computed in the electronic database in REDCap using the airway opening pressure, PEEP, plateau pressure, and POC measurements. There are additional resource videos on the Practical Platform website describing how to measure airway opening pressure and respiratory system elastance. After this assessment on the standardized ventilator settings, the patient can be randomized to an intervention in the domain.